A protracted back and forth with the Public Hospitals Authority leads to the Consultant Physician Staff Association pulling its trump card. In this report, our BJ McDermott tells us what action is being taken and how patients at the country's public hospitals will be impacted.
Effective immediately, a group of about 120 senior doctors made good on the results of an October strike poll and withdrew their services. Here's CPSA President Dr. Loxley Monroe's account of why it has come to this.
We submitted our templates on the manner in which physicians should be reimbursed, and yet this is 1 year later and we still have not come to any sort of resolution or conclusion to the matter of physician reimbursement. Given the implications of that, that is what triggered this meeting today, that the body as a whole is frustrated and feels that they are not valued in any way by the authorities.
Now, just to give you a bit more background on the issue, 2 years back, the CPSA submitted a proposal to the PHA to address their issues. But according to Dr. Monroe, the authority's counter-proposal sought to settle a deficit between the junior and senior physician salary. The CPSA was at the time assured that it would not be left at a disadvantage. But according to its president, that's exactly what happened.
In 2001, a letter of concern was written to the then managing director, and that deficit was corrected. For the ensuing 3 industrial cycle, the 5-year cycles, they have not addressed that difference. So the funds that they provided really and truly were to correct the deficit that they created because they did not honor the promise of transition from the Ministry of Health to the PHA. So that is what was submitted. As far as actually improving our base salary, which was the whole principle behind the exercise from 2016, that has not been addressed.
Now, as for where things are now, here's what that withdrawal of services means.
Primarily, all of the elective procedures, those will be the first to go off the book as far as provision of service. Emergency services shall be covered in one way or the other. The other idea is that these services can be withdrawn in the various organizations where the consultants work. In other words, they may be done in Freeport, they can be done at Princess Margaret Hospital, as well as at the Sandlands Rehabilitation Center.
Now, our news team reached out to Health Minister Dr. Dwayne Sands for comment on the issue. However, he stressed the need to gather all the facts before doing so. Reporting for JCN News, I'm Berthany McDermott.
Well, the PHA has in a release assured that all necessary proactive measures would be taken to limit the impact on services. What those proactive measures are were not revealed. What the PHA did disclose in its argument that it has continued to negotiate in good faith, offering significant improvements in existing benefits, and that it's satisfied that it has done everything to move negotiations forward. According to the PHA, this included establishing a number of consultative committees to actually improve the dialogue between parties, providing significant improvement in existing benefits to the CPSA, inclusive of medical insurance, subsidized mobile telephony, a doctor's lounge, payment of casual mileage, access to a defined benefit contribution plan, and a pay package over the 5-year period of the proposed agreement, resulting in a 16.5% increase in base pay compensation. This, along with improving the CPSA's hourly base pay in excess of $56 per hour. Now, standing in solidarity with the CPSA is the Bahamas Doctors Union, whose president, Dr. Millicent Bassett, says they've actually been in talks with the CPSA to ensure that emergency health care services are not withdrawn.
These are met. We will support our consultants in ensuring that they are duly compensated for the hard work that they do. And when we do get our approval for our strike vote, they will support us as well, because there are many issues that we face that we all share together. And we can't provide the best health care to the public if we are disadvantaged.
Dr. Bassett says the BDC has made applications to the Department of Labor for its own strike certificate.
Of labor, there have been some hiccups with that. We are seeking legal advice as to how we can proceed because we've met all the legal requirements to get an approval. That has not been forthcoming. And something as simple as ensuring that junior doctors are paid the legal and constitutional double time for working holidays, we have to battle administration for in the 21st century.
The BDU boasts a membership of some 460 junior physicians. Meantime, the Bahamas Union of Teachers stands ready to take its own action. Leah Cooper has that story.
The Bahamas Union of Teachers has taken the first step. It's written a letter to the Minister of Labor requesting permission to take a strike vote. This after nearly 6 months of unanswered complaints and reportedly no action from the Ministry of Education. Acting Union President Joan Knowles Turnquest says the list of grievances at the C.H. Reeves High School spans from mold in classrooms to a rat infestation.
The Bahamas Union of Teachers wishes to announce officially that a trade dispute has been filed with the Department of Labor. A walkabout inspection was done by the Department of Labor to ascertain if mold is present. However, the results of this walkabout has not been revealed to the union to date, and we have the letter to that effect. Consequently, BUT wishes to advise that upon the request of the members of C.H. Reeves Junior High School, a letter requesting a strike vote has been sent to the Minister of Labor requesting the same. The Bahamas Union of Teachers stands in solidarity with its members in addressing conditions of unhealthy and unsafe working environment and request that the Ministry of Education seek to correct the malfunctions that exist at the school forthwith, and to look amicably at rescinding the show cause letters as the teachers are bombarded daily with adverse, unsafe, and unhealthy working conditions.
Here's Area Vice President of New Providence, Vernon Rogers, with added health concerns.
And one of the major problems is the roof that is leaking. Come to find out there's some chemicals in the roof that we're not aware of, neither the teachers and the ministry cannot give us any answers. That is affecting them. Stuff drip on them, it burns their skin. Psoriasis, some teachers breaking out, some teachers' thyroid glands are swollen because of the environment. And the roof is a major concern to the teachers and to the whole entire school.
As for parents who may have some concerns, Mrs. Turnquest made this point.
I think health is more important than anything else. If you can have all of the education you want, and I am 100% behind that, but your health is more important than anything else. We take a lot for granted. We take a lot for granted. We have teachers getting sick. We have students getting sick as well. We stand in unison with our teachers. We want to do what is right. The teachers want to do what is right. That is why they are teaching. They're still there. They had to remove the plexiglass out of the windows because there were rooms that the teachers were working in that had no air conditioning, no ventilation. So you would rather your student, your child, be in that type of environment?
The union is only now awaiting a response from the ministry in terms of when and if it can take a strike poll. Reporting for JCN News, I'm Leah Cooper.
You're watching JCN News. Stay with us.
This segment of the news was brought to you by Alive.